Great, thank you, Karen. Karen has helped provide the foundation for today's discussion. Now we're going to ask Dr. Richard Catalano to tell us more about the research on PYD and its impact on teen pregnancy prevention, mental health, and substance abuse.
Thank you, Wilma, and thanks people for inviting me to come to speak to you, and thank you and the audience, both locally and nationally, for joining us for this hour on youth development. As Wilma said, I am the director of the Social Development Research Group, and along with David Hawkins, the founding director, and Kevin Haggerty, our associate director, we've been doing research on youth development for over 30 years. And I have two objectives for today. The first objective is really to say why, to share with you why we should care about preventing adolescent risky sex, teen pregnancy, and other kinds of adolescent problems. And the second objective that I have is really to say, what do we know about programs, and do programs affect youth development? Can we insert these youth development practices that Karen talked about into programs, and can they actually change the trajectory that kids are on during adolescence and young adulthood? So I'm going to talk to you a little bit about an evaluation of positive youth development programs that was commissioned by the Center for Disease Control. And my partners in that were Lori Gavin, who was the main person at the Centers for Disease Control, Chris Markham at the University of Texas, and I had the honor to be a senior advisor, and they did all the work. So it was a great opportunity for me at that time. We really looked at youth development programs that had an impact on adolescent sexual risk behavior and through the whole gamut from initiating sex early to contracting an STI to having a pregnancy during the teenage years. So first of all, to answer the first question about why we should care about preventing risky sex and other kinds of adolescent problems, just a couple of data slides. Here's a slide that shows that we've made some progress over the years in reducing the amount of initiation of sexual activity that kids engage in during high school, but still 45 to 60% of the kids are actually engaged in early sexual activity or activity during high school. This really is a public health problem because we have about 750,000 teens every year get pregnant, even though we've had progress on that over the years since 1991, as Wilma pointed out. That's still a public health concern. It's almost 1 million, 750,000, and over a quarter of those adolescents today have contracted some type of sexually transmitted infection. In addition to that, we see that these behavior problems, going beyond just risky sexual behavior, but things like mental health problems, risky driving, youth violence, and teen pregnancy, alcohol and substance use, often involved in many of these different behaviors, account for about 72% of all deaths of young people. So these types of forms of mortality are actually due to behavior problems, and as Wilma said at the beginning, teen pregnancy can be prevented, and so can these different problems be prevented as well. There's a long history of research showing that. So I'm going to share with you today some data on youth development programs and tell you about how we structured our youth development program review. we started with a large selection of programs, but we still had to have criteria for what would count as a youth development program. Karen's given great ideas about what youth development is, and we looked for programs that had used many different youth development constructs, put them in to their programs, and we decided that if a program would address at least one youth development construct across multiple domains, family, school, community, or if there were multiple youth development concepts that Karen mentioned that would fit into a single domain, like at school or in the family, but they addressed multiple youth development constructs, we could include them in our review. We focused, again, as Karen said, on both promotion programs or youth development programs as well as prevention programs, as long as they addressed these critical youth development constructs. And we looked at programs that addressed youth who were 20 years of age or younger. So what were that was the program development or program description criteria. We also had a set of criteria for the methods or for the evaluation methods themselves. They had to be an experimental or quasi-experimental study. Those are the most rigorous kinds of studies. They answer a compared to what question, comparing those who were in the program compared to those who were like them but not having the opportunity to participate in the program. And they had appropriate statistical methods, as well as in this particular case, we wanted to see that the program assessed at least one reproductive health outcome measured during adolescence. So we set about looking at a lot of different electronic databases. We looked at 8 different ones, looked at a 20-year period, a little over 20 years, to looking at published literature as well as what's called the gray literature. Those are published, unpublished reports in agencies and other places, but that use these methods. And we summarized them in a standard review form that 2 people had coded, and the program summaries themselves, we checked those out with the program developers to make sure that we were following true to what they intended. What we found was out of hundreds of potential reports on evaluation, about 30 programs met our eligibility criteria, both in the program and youth development area, as well as in the methods and making sure that they were strong and rigorously tested. These programs were available, were actually put in place across development from early on in ages 3 and 5 to mid-childhood and primary school, as well as middle and high school timeframes or early and late adolescence. They weren't always done in schools. Some were done in families, some were done in communities, some were done in schools themselves. And what we found of those 30 programs that met the criteria, about half of them were effective and had an impact on at least one reproductive health outcome. And as you can see on this chart, there's different types of health outcomes, reproductive health outcomes were found in different programs. And the really interesting thing compared to a lot of sex education programs, which we know are very important, and there are effective models of sex education programs, particularly in schools, but they often have small and medium-term effects. What we found with these youth development programs that was really, I think, surprising in some ways, that something that started in early childhood could actually have impacts into young adulthood, or things that started in primary school could have multiple years of impact, that it continues to put kids on a better trajectory. We found these programs really sustain their impact beyond the intervention. Many affected other youth outcomes, including things like positive educational outcomes, reducing violence, substance use, and mental health problems. Not all the programs affected all of these, but if you refer back to slide 2 in the review, you can check out which programs had which outcomes. Just to do a quick summary here, most programs targeted youth that were already at high risk, whether they were living in disorganized or low-income neighborhoods. Many of the kids participating in the programs were from single-parent households, children of divorce, so they were all mostly high-risk kids. 14 of the 15 programs used mixed gender groups, and about half of the programs were in mixed racial or ethnic groups, and as you can see on the slide, some were specific to different groups. You can see the most important youth development concepts are the ones that were used in half or more of the effective programs are on this list, as well as those that were only in about a quarter of the programs. And in conclusion, there is evidence that positive youth development programs can promote adolescent reproductive health, and many affect other outcomes as well. They have a relatively robust and sustained effect, and they have the potential to reduce health disparities among disadvantaged populations. Thank you very much.